to say exactly what you have said. Na usibadilishe. Hivyo tu umesema.
Mr. Moses Mureu, I think with this report being tabled here now, we would have gone further and probably propose a way of intervention, because looking aloud, there are a lot of suffering, and the ministers, we are not excluded. So that we don't keep reinstating, deposing, we should get a way of intervening so that we help the ministers and their families who may be going through maybe psychosocial problems.
Taken, I think that goes to the moderator. Part of it goes to the moderator, and he is in the house, working with the presbyteries and also receiving reports of what is happening. Of course, there are many cases we have arrested, we have helped, but sometimes some issues are brought to us too late, when already lots of damage has been done. So presbyteries, when you have any issue with your personnel, a minister, let us know how we can intervene early. Ministers themselves be encouraged through their fraternos, if they have issues, not to bottle them up, because they may get help. Those that we have been able to get access to, we have done our best. But sometimes it gets to us too late when there is little we can do. But that's an important observation. Elder Guyo?
Thank you, moderator and the assembly. I wish to appreciate the good work that has been done by the Boundary Committee. The achievement of subdivision of all these parishes has taken services and really the gospel closer to the people. And would also like to comment that I also note that there are other parishes that existed that were being downgraded and others were being merged. And I think we would like to also say that the Boundaries Committee, when doing this exercise, should really be very careful on details and everything to avoid a situation where we are upgrading and downgrading. Secondly, there is also the issue of ministers as we subdivide the parishes. I think that's also an issue that need to be looked at, so that we do not create parishes and we cannot supply them with ministers. Thank you, sir.
Thank you. As a comment, with no other comment, maybe you could lead the two paragraphs we said that we include in the report, then we go to the resolutions. Have you got them? You're still writing them. So do we wait until, do we have a choir? Okay, do we maybe paid that work because it may take a little time and move to health? We could agree, because there are people who say in their language, we could paid the writing of the two paragraphs, because we don't want them to be worded in a hurry, so that once they are done, we can come to the resolutions, so that we move to health board. Because I know those from the hospitals are here, and it's getting late. Will that be okay? Has it proposed?
I propose one.
Is it seconded by an elder? Elder Dumo. Is that agreed? Okay, then we could ask then the Secretary General or the Principal Clerk to take up his place once again. As they do the health board report, you could be able maybe to draft, or we could even give it some other time. You hear the vizuri kabisa. You're almost done. Okay, health board. The chair is past moderator. Ashukue kiti chake na kuongezewe viti, secretary DSG na watu wao wanaofanya kazi nao kwa mahospitali. Hivi viti ni vyenu. Kikuyu, Joel, Catherine, Chogoria, Mukindia, Tumutumu. You have a bigger team. Una watoto wengi health board. Dr. Karithi uko hapo. Engineer Githinji. Karibuni nyote. Hapa viti ni vingi. Visingekuwa vichache tungewaambia. So, health board report.
Moderator of the 23rd General Assembly and commissioners and delegates. The report of the Health Board to the first GAC of the 23rd General Assembly is contained in document 13. Document 13. Document 13. Introduction. In the year under review, Health Board has been active throughout our churches, especially when most services were not active. Health services were very active. We wish to sincerely thank all our hospitals for the services they rendered. It's document 13. The members of the Health Board, Reverend Jesse Kamau as the chairperson, the very Reverend Dr. Jesse Kamau as the chairperson, Reverend Paul Kariuki as the secretary, John Waroe, Dr. Patrick Impiatu, Catherine Monene, Professor Jotham Misheni, Dr. J.N. Karithi, Simon W. Njoke, Reverend Joseph Gashwe, Reverend Samuel Riongo Moratha, Reverend Mike Konjige, Reverend Jennifer Mushemi, and Reverend Henry Rubonga. Meetings. The committee held 2 meetings in the year under review owing to COVID-19 challenges. One on the Health Week 2021. The Health Week was observed from 4th to 10th of October 2021 in our churches under the theme, quote, hope in times of crisis, end of quote. And the scripture from Lamentation 3:22, quote, because of the Lord's great love, we are not consumed, for his compassion never fails, end of quote. We note that COVID-19 was still with us and other ailments, hence the theme came in handy. We thank our churches and our hospitals for their excellent participation. 2, Health Board issues. The Health Board has continued to strengthen the infrastructure of the PCEA hospitals and their respective health boards, hospital boards. Hospitals with a strong administration and sound financial base will be able to offer quality health services to the community at affordable costs. Presently, the Health Board is focusing on the following. A, proposed level 4 hospital at Lumuruti. It has been the plan of the Health Board to have a mission hospital in all our 5 regions. Presently, the church has hospitals in 3 regions, namely Central, Eastern, and Mount Kenya regions. A committee has been set up, composed of members drawn from the 3 PCA hospitals to look at the possibility of putting up a hospital at Rumuruti Mission Land in the Rift Valley. Baseline survey has been done, which has shown the need for establishment of a hospital in partnership with Medical Benevolence Fund, MBF. Master plan is being prepared in view of soliciting funding for putting up the proposed hospital. B, mental health. Globally, mental health issues are a real and of great concern today. The WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Statistics indicate that estimated 792 million people worldwide are living with mental disorders. Additionally, it is estimated that up to 25% of inpatients and 40% of inpatients in health facilities suffer from mental conditions in Kenya. With the above understanding, PCEA has a need for a mental health division. 3, health Sunday submissions. The department experienced a lot of financial challenges due to non-remittance of health week money despite many resolutions in previous GACs and GAs. Only a few parishes have submitted the required health Sunday money to the health board. Insufficient funding of the health board does affect its proper functioning. 4, hospital reports. In the year under review, the following is a report of our 3 hospitals capturing key highlights of the leadership, services offered, achievement, financial performance, and the way forward. In this regard, Moderator Sir, I would wish to call upon the hospital administration in Chogoria, Tumutumu, Kikuyu hospitals to give a snap view of their reports.
I may not be very generous in terms of time, so I may ring a bell. So 2 minutes each, at most 3, so that we hurry up. Tuanze Chogoria, who is reporting, the administrator.
Pana Moderator, sir, thank you for this moment. Catherine reporting for PCEA Chogoria Hospital. And PCEA Chogoria Hospital is a level 5 hospital. We are situated on the eastern slopes of Mount Kenya, and our bed capacity is 312. We are teaching and referral hospital in the eastern region, and our we have a board of management that is composed of 12 members. The board met 4 times in the year, and it has 4 working committees under various disciplines: clinical, financial, HR and admin, and audit committee and executive committees. Then we have hospital administrative team that is composed of 7 members that learns the day-to-day activities of the hospital, and these members are along the administrative lines that support the hospital services. Our services in the main hospital are inpatient, with a range of services ranging from general services to specialized services, which we are trying to introduce because we want to maintain our referral status on the eastern region. So we have introduced specialized services in cardiology, in dermatology, in oncology, and we are also improving on diagnostics for outpatients. And among the general diagnostics, recently we introduced the MRI and also revived the CT scan services that the hospital is offering. We have a center at Chuka that is supporting referrals to the main hospital, and generally the services offered in Chuka are outpatient services. And last year we managed to get accredited by NHIF, and like the other years, which it took quite some time before accreditation. It was a struggle, but we managed, and this saw the numbers from in Chuka Hospital rising from 4,000 to 10,000 in that year. The year was affected by COVID, where we know that patients fear to come to hospitals, but eventually they gained the confidence, and the numbers rose slightly from 6,000, slightly from 2020.
In conclusion?
Sorry?
In conclusion?
In conclusion, on the way forward, we are growing the hospital to the next level of specialties, where we are introducing specialized services in several areas, and we have improved our theaters from 2 to 4, so that we are able to become a center of surgery in Eastern region, our line being orthopedics. And then we are improving on the teaching line, where we have added courses in our Clive-Ivan College of Nursing, but now we have changed this to Clive-Ivan College so that it can cater for TVETA courses. And we've already put a class in perioperative technique. And in September, we are introducing the nephrology course. And then we are also growing our surgery trainings from COSEXA. We want to go to PACS, which is wider than the COSEXA training. Then in finances, we saw improvement in finances, where we made an income of 607 compared to 500 million in 2020. And the difference is that this time we have made a positive, which compared to the other year, it was a negative. So I want to affirm that the hospital is doing well, and we look forward to implementing our new strategic plan that we are just about to inaugurate. Thank you, Moderator.
Thank you, Makofi kwa Chogoria. Then, is it Tumutumu? Oh, which is next? Okay. Briefly, please, because of time.
Thank you, Moderator, sir. My name is Kinywa Mkindia, the hospital administrator. Let me begin with what is very good to our ears. Mr. Moderator, sir, and the assembly, the last time we met in 2019, we said the way to turn around the hospital from loss making is to enhance our revenue streams and to increase revenue. I am happy to report that PCEA Tumutumu Hospital, the year under review, the year 2020-2021, we were able to turn from south to north, and we were able to register a surplus of 24 million, down from a loss of 11 million the other year. This was actually made possible after revenue increment of over 100 million Kenya shillings. Moderator, sir, the other bit is it's on what we have achieved under the year under review. We have been able to increase our theaters from 2 to 3 at a cost of over 10 million Kenya shillings. We also have construction of the ultramodern outpatient complex, which will also include accident and emergency center, at a cost of 110 million Kenya shillings, which was a grant from His Excellency the President. I am happy to report that the building is approximately 30% complete. Other areas, Moderator, sir, we are doing very well in the college. Previously, we have been having problems in admissions, but now those people come from Mount Kenya region. They appreciate that now there's a lot of vibrancy, economic, as far as economic matters are concerned. The college, which previously and an average of, we were operating at an average of 100 students. Today, Moderator, sir, we are over 250, and now we have for one to get admission. Now someone must be interviewed, because like previously we had application for 70 and we needed only 40. So I will encourage that if you want to be considered from your presbytery, you do your application quite on time. Moderator, sir, and the assembly, we are under the during the year under review, we were also able to get a generator at a very huge one, with a capacity of 250 kVA at a cost of 10 million Kenya shillings. That one is a milestone. We have also been able to do a partnership with both Tumutumu Parish and Tumutumu Presbytery to accommodate our students, because the capacity which we have was inadequate. I'm trying to move very fast so that I'm not going to conclude. Moderator, sir, the other bit is on accreditation process. We are introducing additional services in the hospital: oncology, dental, ophthalmology, and with the process of accreditation by NHIF. And once that one is done, again, we foresee a jump in our revenue.
Conclude, please.
As I conclude, Monitor Sir, chaplaincy is doing quite well also, and we are giving all the support which is necessary. And then, what now we intend to do, the way forward, Mr. Monitor Sir, we intend to procure a parascopic tower at a cost of 10 million Kenya shillings. This again will be a game changer. Also, we are looking for partners to have MRI in the region. The other bit is we want to introduce, God willing, in the next financial year, training on iron diploma in critical care nursing, and the bond is looking at all the support services to ensure that we expand our ICU. And as I conclude, just as my colleague from Chogoria has said, is we are looking forward to be a hospital of choice, a regional hospital of choice, and we pray that we keep on giving us support. And lastly, we will forever be indebted to the Executive the President because of the Kenya shillings, the grant of 110 million Kenya shillings, which he gave us.
Thank you.
And also, we have also gotten a partnership moderator to Tamak, their own, which is giving access to the college. Thank you very much, sir.
Thank you. Makofi. Kikuyu, now you have learned how it's being done. So, I may be a bit hasty on you.
Yeah, thank you,
Joel.
Moderator, sir. I'll be very brief. My name is Jamhuri Joel. I'm the Hospital Administrator at PCEA Kikuyu Hospital. PCEA Kikuyu Hospital is a training and referral hospital. We train doctors in general surgery and orthopedic surgery. We are a 233-bed capacity hospital. We constituted our new board in March this year. We are 13 in number. And we have a senior administrative team that runs the hospital on a day-to-day basis. We are 13 in number. We have a very vibrant chaplaincy department composed of the chaplain, the assistant chaplain, and 5 evangelists. And we are currently integrating the spiritual ministry with the day-to-day operations of the hospital. In terms of staffing, we have 544 in number, composed of 424 regular employees, 44 locums, 35 consultants, 1 seconded government dentist, and 40 interns. We continue to train and develop our staff in various fields of education. And we started our School of Nursing in October 2020 with 3 students that grew to 11 in 2021. That is March. And then in September 2021, we grew to 25. And currently, we are approaching 60. In terms of performance, we made a surplus of 28.3 million compared to 65.9 million budget. That is the last financial year. We have a comprehensive care clinic program where we take care of the HIV positive persons. And we have a total of 2,196 clients under this program, which is funded by CDC through Christian Health Association of Kenya. We also carry out community outreach program. And in the last financial year, we screened 3,638 patients spread through 10 counties, that is Kiambu, Nairobi, Murang'a, Nyeri, Kirinyaga, Nakuru, Machakos, Makueni, Kitui, and Kajiado. We have major ongoing activities. One of them is expansion of the kidney dialysis center to 20-bed capacity from the current 5. And in mid-May this year, we'll be able to start the first dialysis. We are currently constructing a new School of Nursing ablution block. We are refurbishing additional rooms at the new Matasia Clinic. And of course, we are doing very aggressive marketing. Major achievements. We established our first satellite clinic after 114 years at Matasia. And like I mentioned earlier, we are currently integrating spiritual ministry with medical operations. And I'm glad to announce that on 13th of April this year, we got ISO 9001-2015 certification. So those of us who will visit PCEA Kikuyu Hospital will experience new services in terms of customer service. Then we completed and dedicated a new pediatric ward in February this year. And we've started MRI services, which is the only one in Kiambu County. We started in November last year. We've installed 63 CCTV cameras just to enhance our security system. And we've procured quite a number of medical equipment with support from our development partners, mainly CBM, that is Christian Blind Mission. And we also completed and equipped a new mini laboratory at the rehab unit. Our development partners are CBM, like I mentioned, Ministry of Health, the County of Kiambu, MBF, Wilson Foundation, CHAC, and the rest. Lastly, major future plans. We plan to construct a new hospital block, 4-story building with 1 basement. We've already gotten approval of architectural drawings, and currently we've lodged the structural drawings. They are being approved.
Thank you. Thank you. Conclude then your last 2 sentences.
All right. Then we are establishing medical health services, construction of a School of Nursing complex, and installation of an incinerator, and finally procurement of a School of Nursing bus. Thank you, moderator.
Thank you, Kikuyu. Asante. Makofi.
In this regard, moderator, I call upon the chair to second the report.
Moderator, in conclusion, we want to extend our sincere gratitude to the PCEA Church leadership for the support during the COVID-19 pandemic. And in addition, we want to thank our staff members who have continued to work hard despite the challenges that we face, and as we deliver quality healthcare services to the patients. We also thank God for the support we have continued to receive from the church, the development partners, and the other stakeholders in advancement of our mission to express the love of Jesus Christ through the provision of quality health services. There are many things we can say. Patients have been healed. Others have died to go to be with the Lord. Others who are not sick are on their way coming to the hospital. With that, I conclude the health report. Thank you.
Thank you. Thank you very much. We now invite questions from you. Questions you can ask a question related to the entire health board. You can ask a question specific to a hospital. They are here. They will answer. Hizo hayo maswali mnaulizanga kwa barabara. Sasa muulize hapa.